Well, what's unique about Memorial in Johnstown is we have surgical residents, so we do surgical training, so it actually keeps all the attending surgeons up on their toes and the latest modalities for surgical care.
Welcome back to the Conemaugh Connection. In the first week of the 2007 NFL season, Buffalo Bills tight end Kevin Everett suffered a life-threatening spine injury. Many thought he would never walk again, but Everett's treatment included an experimental procedure that cooled his body to about 92 degrees, a procedure that some doctors believe may have contributed to his miraculous recovery. Cooling the body is a technique still being studied for spine injuries, but it's now being used routinely at Memorial Medical Center for cardiac arrest patients. Doctors in intensive care believe in some cases this induced hypothermia may be the difference between a patient waking up or not. Every good team knows that the game is won on the practice field, where every movement can be rehearsed and every decision analyzed. It's true in sports, and it's true here as well. Only this practice field is Memorial's Human Patient Simulator Lab, and this team, it's special too.
Well, it has physicians, nurses, respiratory therapists, pharmacists, and all of those people receive some training in basic CPR or advanced cardiac life support, but they never train together. And so what this allows us to do is bring all those people in together in a simulated environment and let them learn how to work as a team.
But sometimes restarting the patient's heart is not enough.
The brain usually takes somewhat of a hit. It's a secondary hit, but it does take a hit from the lack of circulation and oxygen being delivered to the brain.
So once we revive them, that actually introduces a new risk to them, that as blood starts going back to the brain, reperfusion, toxic substances can be produced in the brain that can cause further brain injury and brain damage.
So for the past 5 years, Memorial's critical care team has been using a hypothermia protocol, a cooling of the body for those cardiac arrest patients who have been successfully resuscitated but are not waking up.
Within 4 hours, we want to usually take them from a normal temperature, which is 98.6, down to 32 to 34, which translates to 92 to 94 degrees Fahrenheit.
In the past, cooling blankets or even ice packs were used, but now a new product called Arctic Sun provides a more efficient method of cooling the body.
This wraps around the patient, this goes next to the back, and then it wraps around.
You know, with the old system, you sort of had to pick between the heart or the brain, and that's obviously a tough choice, and so now we can really direct treatment at both.
At Memorial Medical Center, the technology is also being used on trauma patients with traumatic brain injury.
When you have a traumatic brain injury, you can have a primary injury, which occurs as the impact, but then there's this generation of secondary injury. You have sort of injured brain cells that have potential to recover or they have potential to worsen, and they can recruit other cells to become damaged too.
Innovation, new protocols, a commitment to learn and improve has been a cornerstone of Memorial's Level 1 Trauma Center, which recently celebrated 20 years and 14,000 lives saved. One of those lives belongs to Ronald Markowski.
I was involved in an accident involving a log truck. They extricated me from the vehicle, flew me here, a medical helicopter. And I don't remember much after that coming in here. What the wife says, what they had to do those 2 days was miraculous, to say the least.
And you don't realize it until something like this happens, and it's a life and death situation. And you're thanking God that this is here for that life. Because without this and so close, he'd have died.
Trauma affects majority of us right at the prime of our life. Affects without warning. Your whole life and your family's life is completely put in disarray. And it's imperative that there's an organized system there to help put the pieces together. People think that the surgeon and the nurses, that's just the first layer. And there are just literally hundreds and hundreds of people whose input is vital to make sure the patient has a good outcome at the end.
The Regional Resource Trauma Center at Memorial is the only Level 1 trauma center between Pittsburgh and Harrisburg. What amazing work they do. Coming up, out of about 7,500 home health agencies across the country, Conemaugh Home Health ranks in the top 1%. Why? We'll show you after the break.
So we're aware of the current updated therapies and medications for particular problems.